First, I want to start off with a little discussion about the thing that's on everyone's minds these days: coronavirus, COVID 19, the thing that is going to kill us all. So, let's see, I came across this live. Yeah, it was about a week ago. Yeah, exactly a week ago, actually. I came across this thread on Twitter. And basically, this thread is probably the worst thing I've seen until a thread I came across today. So, what he's discussing here is the Imperial College uh, study on the possible effects of the coronavirus. Uh, and basically, what they did is they took the data we have from fighting, uh, the data we have from China, Japan, uh, Korea, and ran it through their models that have been developed through decades of testing and working on other infectious diseases and how other pandemics have wound up. It's not good, folks. It's real not good. So they he starts off here with the absolute worst case scenario where we treat COVID 19 like the flu. We act like everything uh, is normal, and we pretend that this will just go away if we starve it. I think is the wisdom for a flu. You starve a flu, right? Yeah, that's bad. If we just let that happen, no social distancing or minimal social distancing, 80% of Americans get infected. Now, the thing is that this is modeled after other infectious diseases where things like the flu can reach that level of saturation. We have medicines and, more importantly, a vaccine so that even if someone gets infected, it doesn't, you know, hurt them that much. Maybe they get the sniffles, maybe, they're down for a day or two. We've all had those flus, especially if you get a flu shot, you feel like shit for a day or two. We don't have anything like that for coronavirus. We're 18 months away from having that for coronavirus. So, in such a situation, 80% of Americans would get the disease. He's assuming here approximately 1%, 0.9% of them would die. 2.2 billion Americans from the virus itself. Okay? 2 million people. That's just from the virus itself. 50% of those put on ventilators will still die. So even if we magically had enough ventilators for every single person who will come down with this who needs it, half of them are still going to die. But the need for ventilators, unmitigated, where 80% of the US population gets infected and some percentage of those need ventilators, that percentage is 30 times the number available in the US. So in reality, for the patients who need ventilators, 100% of them are going to die. So the actual death toll, as it says here, will be closer to 4 million Americans in 3 months. 8 to 15% of all Americans over 70 would die. Now, this is important because recently Trump and other conservatives have been making noises about sending people back to work. This is what happens: 10% of the people in America over 70 die. And another percentage of people under that age also die. We're talking about one of the largest mass deaths in history. The American deaths alone almost equate to the Jewish deaths in the Holocaust, which is something he uh, compares it to. Right here, how many is 4 million people? The population of Los Angeles. So that's just everybody in Los Angeles dies like that. It's like that old comic book, um, Emerald City, where it was a Green Lantern comic book I remember from when I was a kid. And as part of the Death of Superman arc, uh, what the hell, the West Coast city that is supposed to stand in for LA or San Francisco gets completely annihilated, and Green Lantern goes nuts. So imagine that happening, in real life. 4 times the total casualties of the Civil War. Civil War was one of, if not the bloodiest conflicts in American history. So he extrapolated these for the rest of the world, and he admits the margin of error is high because obviously this is assuming the rest of the world similarly just goes pants on head retarded, excuse me, pardon me, just goes ridiculous and completely ignores any kind of safety advice, any kind of social distancing or quarantining. And he says 90 million deaths globally in 3 to 6 months. Now, margin of error is high. We don't actually know it will be that many people who die. Probably won't be. Um, because again, we have one of the worst healthcare systems in the world. Uh, and also, our government is proving unwilling to take the steps necessary to control it. If they if they did take the steps to control it, we'll discuss that. So, right here, this is the first step to control it, the mitigation. Symptomatic cases in absolute isolation, families of people with symptomatic cases quarantined, complete social distancing for Americans over 70. This is sort of the middle ground where we keep most things open, but we make allowances for quarantine. This is more than we're doing now, to be clear. Well, in most areas, uh, because in most areas they're not trying to isolate people over 70 specifically, because they're just telling everyone to isolate. Like in Illinois, New York, just everyone stay home. So it talks about this is what they say when they say we should flatten the curve. Try to slow the spread of the disease to people most likely to die from it to avoid overwhelming hospitals. It does flatten the curve, it does help, but not enough. Cuts it in half. Only 1 million die from the disease itself. The peak need for ventilators falls by 2/3. That's awesome. Still more than 8 times the number of ventilators available in the US right now. Now, there is some good news. Uh, there is there's quite a lot of organizations that could step up and start manufacturing ventilators to help with this demand, but no one's asked them to. It's one of the problems with capitalism. These companies will not step in out of the goodness of their heart and tell people and start manufacturing things that are needed. What they will do is they'll wait until someone asks for them, until someone orders them, until someone pays them. And of course, what this means with Grifter in Chief right now is that he's trying to make sure that his buddies get paid. That's why no one's making ventilators right now. More than normal, which is not enough. So the total, right around 2 million deaths in America if we do this minimal mitigation. That's the population of Houston. So Houston, Texas, wiped off the map. Just like we just did LA, Houston's gone now instead. Twice as many people who died in the Civil War. 45 million people died globally. Now again, large margin of error. We don't know how many people will actually die outside of America if we follow this plan, because of course we don't know what steps they'll take. I mean, realistically, we can assume that they will shut down imports from America if we don't isolate the way we want to. That kills our uh, already struggling farming farming sector. Um, what little manufacturing is still in America will take a hit. That's putting everyone back to work, and then they have no one to sell to. So, worst case, middle case, best case scenario: full on suppression, isolate symptomatic, quarantine their families, social distancing for the whole population, all public gatherings shut down, schools and universities closed. This is the total lockdown, complete quarantine, like what happened in China and Italy. It works. It peaks 3 weeks from now at a few thousand deaths, then goes down. We hit but don't exceed the number of available ventilators. So we ride the curve, we ride that line. The nightmarish totals from up here, completely gone. But as you said, here's the catch. If they ever go away, if we ever stop suppressing, like they're talking about doing now, like I think they've done in China, it comes back. The virus comes back, and we're right back to option A or B, depending on what we do to respond to it. And here's the real problem: we have to keep that going until we have a vaccine. Fortunately, multiple teams have developed a vaccine that is ready for trials. In fact, they already, as of a week ago, injected injected it into a human for trials. It's good. That's good. That means we're closer. We're as close as we can to uh, the vaccine. But to paraphrase one of my favorite old sayings, the best time to plant a tree was 20 years ago. The second best time is now. So the best time to develop this vaccine was 2 years ago. Second best time is now. We have it. It's available. Well, it's in trials. And it has to stay in trials for 14 months. Because if you're injecting something into basically the entire human population, you want to make sure that it doesn't kill them after 8 months. So that means that we have to wait 14 months to find out what happens to the vaccine. And then after it's approved and we approve that it's fine, then we have to produce it, distribute it, and get people inoculated. That's the hard part. That's the massive, and that takes time. We're looking at 18 months before we can really realistically relax social distancing, absent any kind of easily manufactured cure or other means of fighting this disease. There is some light. We can possibly find something to mitigate it. We might be able to do something to make it not as bad. It's still going to be bad, but if we go on a cycle, it recommends here from this is from this study, which I'll be perfectly honest, I'm a college dropout with a who majored in English. This is over my head. I'm grateful for people who do understand it, who synthesize this information. Um, which is what I'm doing here. Hey, synthesizing it for you, my adoring audience, so that you can better absorb this, because Twitter is garbage, and this is threads are the worst way of communicating information. So the recommendation here is essentially 2 months off, 1 month on. So we huddle inside for 2 months, then we can go out, work, do our thing for 1 month, then come back inside and huddle for 2 months. Individual cities can do it a little bit, can stagger things so that, like, we don't have a situation where everyone's hiding at once and then everyone's returning to work at once, so that maybe we can get things going. But the reality is, we're looking at either tens of millions of people dead worldwide, with a few million of them coming from America, or we huddle in place uh, for the next 18 months. That's the reality of it. Sorry. I came across this thread here, which is a little more recent. Person posted it here today, and this talks about uh, how we can estimate and talk about the fatality rate, or the case fatality rate. This is actually a very, very interesting thread. I learned a lot discussing what coronavirus means and how it can, uh, what is going to happen. So, one of the interesting things he talks about here is that the case fatality rate is not, as many people think, just deaths over number of cases. It's not that simple. I'm trying to find where it was. It's deaths over deaths plus closed cases. So if you have 100 people, 3 of which die and 97 of which you cure, that's a 3% case fatality rate. The problem is, right now, we don't know how many cases we have that are going to die. So even though there's only been a few hundred deaths in America right now, there's thousands of people who are infected, and some of them are going to die. And we don't know what that number is, but we do know that, for instance, in Italy, it was 9%. Like I said, Twitter is the worst. Yeah. The CFR is actually over 10%, excuse me, at the moment. Now, they're getting it under control because they had a government that was willing to lock down their people and provide for them as needed. America's not doing that. Currently, the Republicans are trying to get a bill through that will let them shunt a shitload of money into the billionaires' pockets, and the Democrats are trying to means test it to make sure that only those who deserve it get it, as if the people who deserve it are not every fucking American in the fucking country. Every worker, every person. We're all in this together. Those who can work deserve a little bit extra. Those who can't, or who have lost their jobs, need something to get by, because you sure as fuck aren't going to be distributing food. And I mean, that's really the choice. They use the National Guard to set up and distribute rations and make sure that everyone has what they need to survive, or they don't. They can send out cash to everyone, which would also help. Although, to be perfectly honest, if we don't shut down, I don't know that it is. Because let's be honest here, who's going to buy from us? We're essentially going to be isolated inside our borders, which is exactly what Trump wants, to be clear. He wants to seal off the borders. I mean, we all saw that tweet, right? Uh, uh, anyway, it doesn't matter. He had a dumb tweet about how the coronavirus doesn't uh, how we need strong borders to combat the coronavirus. And of course, Paul Joseph Watson had to uh, chime in about how somehow borders prevent viruses from traveling. It's bizarre. It really is. But so yeah, this is the situation we're in. We need some action, and ha, Bernie Sanders is providing that action, my friends. Uh, he is regularly meeting with top officials and uh, experts on these subjects. He's developing plans and he's trying to get it through. Unfortunately, the majority of the power brokers in Washington don't actually want to help people, they want to line their pockets. So this is where I come to the call to action, so to speak. Stay home. Please, my beautiful friends, stay home. You may be fine, and you may be one of the people who survive it, although there's been a number of young people who have died with the disease in China, Italy, Korea, places that are handling it much, much better than we do. Places where people can go to the doctor without worrying about going into ruinous debt. Stay home. And when they tell us to go back to work, if there's not a vaccine or an easily acquired cure, stay home. We need to prove to them, to the people in power, that we, the people, the workers of America and the world, are the ones who make the economy. We control the labor. They don't. And labor is what builds economies. It's as simple as that. Without labor, nothing happens. You'll hear some people say that labor is only valuable because someone will pay for it. Well, no. Labor intrinsically has value. Now, what that value is can depend on the market or can depend on the people involved. Markets markets are good things for goods and services which are not necessary to life. And they're not good in certain specific situations, such as things that shouldn't be commodities. Housing, medical care, and basic food are three things that should not be market controlled. Because ultimately, they're going to privilege those with money. That's how markets work. If markets go off of how much people can pay, then that's what then the people with the most to pay are the ones who run the market. General strike, folks. Stay home. Don't go back to work until we get what's our due. Take back your labor.